Hello people, in this video let us look at the general anatomy topic cardiovascular system, that is CVS. Okay, so what do you mean by cardiovascular system? So the heart, cardio and vascular system, your arteries, veins, capillaries and the anastomosis, okay, all those will become your vascular. So cardiovascular system, right? So we are looking at it generally in general anatomy. Otherwise in any patient when you're examining this, usually whenever you say CVS, right, CVS actually will refer to S1, S2, that is heart sounds, okay? Heart sounds, any murmurs in an adult, S1, S2 only mainly, okay? Lub-dub sound. So that is what you mean by cardiovascular system. So how do you define it? Cardiovascular system is the transport system of the body. The nutrients are conveyed to places where they are utilized, okay? So first let us go for the definition of cardiovascular system. So what is it? It is a transport system of the body. Nutrients are conveyed to places where they are utilized, and metabolites, that is the waste products, okay, are conveyed to appropriate places where they have to be expelled. So let us understand what this means. The nutrients are conveyed to places where they are utilized, okay. So what is the heart doing? It's pumping. It's just a pump. Heart is what? It's just a pump. It is only a pump, mechanical pump. It is myogenic. It beats by itself. It has a sinoatrial node. It will pump the blood to all parts of the body which are going to, with all the nutrients that they may need, right? Glucose, if they need some amino acids, fatty acids, everything are going to be reaching the places where they will be utilized. Also, when this blood reaches the kidney, what does the kidney do? It will filter out things and send it into urine, right? So what are the kidneys doing? Where are the kidneys? Let's draw the kidneys. So here are your kidneys. So what kidney will do? It will take the blood. So you're supplying it with the blood. Then what it will do? The kidney, it will filter the blood and it will remove the metabolites in the form of urine. Right, urea, etc., excess glucose, whatever is excess, so all those are going to be expelled by the body. So this CVS is responsible for the transport of, it is the transport system of the body actually for the blood, right? And it is going to give the nutrients to where they are utilized and metabolites to where they are going to be expelled, okay? So basically cardiovascular system, the components, if somebody asks you the components, what will you say? The components are the heart, very important. It's the pump. It's just a mechanical pump. It has 4 chambers. It's a muscular organ. It is myogenic. It has its own sinoatrial node which will keep the electrical activity and it will keep pumping. Right? How many chambers? 4 chambers. Yeah, very good. 4 chambers. So look at these chambers of the heart. So you have the, this is the right atrium. You have the right ventricle, you have the left atrium and the left ventricle. So heart itself you can explain a lot. Between these, all these you have valves. So here you have the tricuspid valve, here you have the mitral valve which is the bicuspid valve. Every valve is actually tricuspid except this mitral valve which is bicuspid. Hence they are specifically calling it as bicuspid valve. You need to understand this circulation, guys, how it goes. So basically the heart receives deoxygenated blood, which you can see very well here. The heart is receiving deoxygenated blood into the right atrium. From there it goes to the right ventricle, which is via the pulmonary artery. The deoxygenated blood goes to the lungs, and the lungs are going to oxygenate the blood. So the oxygenated blood from the lung will return to the left atrium, and from left atrium the blood goes to the left ventricle, and the left ventricle is the one that pumps the blood for you to all the parts of your body. Who is pumping? It is the left ventricle. This is the aorta. So you can see arch of aorta here. This is the ascending descending aorta. Here's the arch of aorta. So you have a lot of important arteries here, subclavian artery, etc. So you should know that this is the circulation. And heart sounds lub-dub, lub-dub. Only closing valves make noise. Remember, this is very important for you to know. Only when the valves close, they make noise. So lub is a sound that is because of the AV valves closing. That is between the atria and the ventricles. That will be your tricuspid valve and the mitral valve. And dub is the semilunar valves closing, which are nothing but the pulmonary and the aortic. Okay, aortic and the pulmonary, you can say. Okay, so heart, you have understood something. Right, then you have the arteries, arteries, and then you have the veins. Right. So what are we looking at, guys? We're looking at the components of cardiovascular system. There's a lot to understand. So just we are looking at general anatomy. Then you have something what is called as capillary. Capillary is where very thin between the very thin arteries and the very thin veins, right? So let us understand now arteries. So do you know what and all arteries are there? There are artery is actually muscular. So arteries can be a small size, medium size, large arteries. Like your aorta is a very large artery. Okay. So these large ones are actually elastic, we told you, and the small ones are actually called as arterioles. Small arteries. What exactly do you mean by artery, guys? Artery is anything that takes the blood away from the heart. So anything that takes blood away from the heart is artery. So hence, though the pulmonary artery is carrying deoxygenated blood to the lung, it is still an artery. 90% all the arteries will carry oxygenated blood, but this one is an exception. The pulmonary artery is an exception because it is carrying deoxygenated blood away from the heart to the lungs. Okay, the pulmonary artery is actually having deoxygenated blood. Similarly, it happens in a fetus also. In a fetus, what happens? Let's draw a fetus here. See, this is a fetus. So in the mother's womb, what happens? It is supplied with the oxygenated blood via the umbilical vein. So the umbilical vein carries oxygenated blood. So that is yet another thing that is interesting. Umbilical vein. Okay, because it is carrying blood towards the heart. It is umbilical vein. Whose heart? The baby's heart. So it is umbilical vein, but actually it carries oxygenated blood from the mother. Okay, the ones that return from the child's body, the fetus's body, is actually umbilical artery. There are two of them, and they actually have deoxygenated blood. Okay, what else you should know, guys? This is the histology of an artery, a large one. Look at this. What is all this? You can see a lot of tunica media. Media will have the muscle. See, the lumen is so large that if it is a small artery, no, this will actually be very little curved like this. But this is a large artery, so it's a part of a big circle. That's why you're seeing kind of a straight line here. So that gives you a clue that it's a large artery. And here you can see they have written TM, tunica media. This is tunica intima, right? And this is tunica adventitia. Okay, tunica adventitia itself will need to have blood supply. Vasa vasorum, right? Otherwise, how will it also function? It also needs blood supply, right? The thing with this large artery and all is that it has more elastic tissue here. Elastic fibers are more here than muscle. Look at this. This is our histology diagram of large artery. What do you see here? Elastic fibers they have shown here are more than the smooth muscle, which is less. That's what it's written here also, right? You can see LES. Should we rotate this? Yeah. So look at this. Elastic fibers are more, smooth muscle is less. This is and the blood supply for the adventitia, there is vasa vasorum. The other two layers are taking the blood supply directly from the lumen. Okay. So this is a large artery, elastic artery, example aorta. This is a medium size artery. It will be more muscular. So this is a muscular artery, distributing artery, medium size artery. Same thing they are saying. So you can see here there is more muscle. Tunica media has more smooth muscle. Elastic fibers are less. This is the tunica adventitia. Again, it has vasa vasorum. Okay. And you can see here, because it is muscular, it will have this kind of folding. As it is more muscular, they have shown this kind of folded, the endothelium is folded, look, they are showing, because it is muscular. So the muscle contractions have caused these folded, what do you say, foldings. See, here they are showing you artery, vein and capillary. Artery basically has tunica adventitia, same thing with vein. Then tunica media, same thing with artery and vein. And tunica intima. The layer names are same. But in artery, it is having more muscular looks like. When you feel for pulse, what are you looking for? Radial pulse. You're trying to palpate the radial artery, isn't it? It's a medium size artery. The blood supply to the heart itself, how does it happen? Via coronary arteries, guys. This is important for you to know. Coronary arteries. So you have the right coronary artery. Here you have the left coronary artery, which is coming from the ascending aorta. Very important for you to know these branches. Okay. So obviously there will be venous drainage also for the heart. Okay. So we have looked at the types of arteries. Medium is muscular, you can say. The thing with arteries, guys, is that they are the lumen is small. Okay, the walls are thick. They are thick walled. Lumen is small than compared to vein. Okay, and there are no valves. Veins will have valves. So they are draining into the heart, right? Veins are draining into the heart. So they will have valves so that there is no backflow. Because of all these muscular arterioles and all these muscular stuff, right? That's why there will be peripheral resistance. That's why there will be a diastolic blood pressure. So when the heart pumps, there will be a systolic blood pressure, right? And there will be a diastolic blood pressure because of these muscular arteries, arterioles. Can they ask you in the exam palpable arteries? Look at this, guys. Palpable arteries. So which and all you can feel the pulse. Carotid, common carotid, you won't press both sides. Only one side you should press. Otherwise the supply to the brain will stop. So at common carotid you can try brachial pulse. Radial pulse is what you always feel, right? Very common. Then go down here. Femoral pulse, yes, they will say no radio-radial delay, right? From this radius to radius. No radio-radial delay. No radio-femoral delay. Right, popliteal pulse. Usually we don't feel all this, but dorsalis pedis we try to feel. Okay, look at this, dorsalis pedis artery. We try to feel the pulse. Look at this image to tell you from the heart, from the aorta is coming out, right? From that, what and all you have this is the brachiocephalic trunk. From that you have the subclavian, and then you have the common carotid. Okay, so that's what we told you. You will feel this is the common carotid. This is the right subclavian. Subclavian, common carotid, that much you remember. On the left side you have, this is the subclavian and this is the common carotid, right? There's no brachiocephalic on the left side. Okay. What else you should know? That's enough for now, right? So basically this is only general anatomy. Generally only we are telling you. So where are we? We have finished the arteries. Now shall we move to the veins? Veins means what? They are carrying the blood away from the heart. No, to the heart. So that's why they are saying venous drainage. Venous drainage means what? The blood will return to the heart. So veins are thin walled. The lumen will be large. Okay, these are actually very, very delicate compared to arteries. Okay. So you can say the deoxygenated blood from all parts of your body will return to the heart, right, via the veins. So here if this is the heart, who is accepting all this? The right atrium is accepting all the deoxygenated blood. You have two things that are giving the blood to the right atrium. It is one is the superior vena cava, and then you have the inferior vena cava. From the lower parts, you are getting everything is draining into the inferior vena cava, that is IVC, and from the head, etc., it will go into the SVC, superior vena cava, right? So two vena cavas, it will drain into the right atrium. So you can write the same things, right? It has thin wall, the lumen is large, it has valves. Okay, same thing you will write for veins. In the opposite you will write basically. Okay, guys, let's move on. Do you know that there is nerve supply for each of this? Artery will have nerve supply that is called as nervi vascularis, it seems. And there is nerve supply to vein also. Do you know that, guys, this venous drainage has to work, especially from down here, it has to work against gravity. Okay, so that is why there are valves here that will make sure that they don't go backward flow of blood shouldn't happen. But if a person keeps standing for long time, or they have some a defective valve, what will happen? There will be pooling of blood in these veins that will lead to varicose veins. Okay, this is one of the clinical importance for you in surgery, varicose veins. Dilated, tortuous, elongated veins. That is varicose veins. Look at this, guys. Basically, you can see here that this is your calf muscle, your muscles, the soleus, etc. Right? They will, whenever you move your leg, right, they will contract and they will make sure that the blood returns to your heart. So that's why they are called second heart. This is very important. If you are standing constantly, then it will lead to, this muscle won't move. There will be no return of blood to the heart. So there can be varicose veins. Okay. They'll be stressed, tired by the end of the day, especially security guards, police, teachers, people who stand a lot. Politicians could be if they stand a lot. Okay. So actually the soleus is called as the peripheral heart, it says. Okay. So now we are done with veins, guys. Actually in veins there is a little more that we would like to add. Hold on. There is something called as portal vein Okay, portocaval system. This is something you should understand. Portocaval system. Let's look at this. See guys, there is whenever you eat food, right? Give us that human being. So guys, whenever you eat anything, right, what happens? Your intestine will absorb, right? So it will absorb into veins, which will go into the, see, it's supposed to drain where veins, we told you it has to drain to the heart. But there's an exception here, which is portal vein. It doesn't actually go to the heart. It takes all this blood to the liver. Okay, so what it does is, the liver is your detoxifying tool, right? So what it does, before it can send anything and pump it to the whole body, the liver will ensure that anything that is dangerous, so it will detoxify it. Okay, so here's your liver. So what will happen? The portal vein is entering here, and the liver will detoxify all the things that you have eaten, etc. And then the hepatic vein will leave the liver, and that will go and drain into your heart via the inferior vena cava. So the liver is sitting here in between the portal vein and the hepatic vein. Hepatic vein is a part of the systemic circulation, but this thing is called as a portal vein, right? That is, the portal venous system is a different system. It doesn't go into the heart, as you can see. So here you can see, this is your IVC, right? Inferior vena cava. This is the superior vena cava. So what exactly are they showing here? They are showing you the portal vein here entering the liver. From the liver, you should see the hepatic vein leaving and going into the IVC. So guys, I think this is becoming a little too much. Just understand this, okay? There is a portal and a vena cava, right? IVC, etc. So between these things, vena cava system and the portal system, there can be some links, okay? Wherein all those links are, that location is called as the portocaval shunt. Those are important for you to know, because it is important when there is portal hypertension. You will see that there can be some effects in these places. Where is the diagram for that? Okay, here. So look at this. Below the lower end of esophagus, so that you should know. There can be a portocaval anastomosis, okay? Then superior rectal, okay? Here, anal canal. All these places you should know. I think here in this table they have given well. See here, look at this. Lower end of esophagus, the portal vein, which is the portal vein, the left gastric vein, and the systemic vein, that is the esophageal vein, will have some anastomosis. Anastomosis means there's some joining between these two, okay? Umbilicus. So where is your umbilicus? You know where your umbilicus is? If this is your stomach, abdomen, here, there's an umbilicus. So there also there can be some anastomosis. Then lower end of rectum. So where's the rectum here? So lower end of rectum. What did we say? Lower end of esophagus. Then posterior abdominal wall. Bare area of liver. The liver. Bare area of liver. Then falciform ligament. Ligament venosum. Venosum is where here? Ductus venosus. After the, that and all you will learn in embryology. Anyways, basically, did you understand that there is something called as a portocaval shunt, okay? That is all coming under this veins, okay? So under veins you looked at a lot, guys, you looked at a lot. Now let's move on to capillaries, okay? Okay, the small veins are called as venules. Now let us move on to capillaries. Capillary means what? Look at this image to understand. Here they are saying there's an arteriole, here there's a venule. Between this there is something, right? There's a mixing of blood, looks like. So basically all the oxygen is leaving and then it is becoming deoxygenated. Here the capillaries. Capillaries are the one that are helping in the diffusion of the oxygen. The exchange of oxygen, they are so thin that they can allow the oxygen to escape, right? So those are your capillaries. So what do you want to say about capillaries, guys? Capillaries. So they are networks of microscopic endothelial tubes which are between the arterioles and the venules. Okay, so they don't have any smooth muscle cell. Okay, those are the true capillaries. They don't have any smooth muscle cells. Okay, what else you should know? They are saying that in the sex organ, in the placenta, etc., the capillaries are replaced with cavernous, that is dilated spaces. Okay, that is something else. Then there is some other terminology called as sinusoids. What is sinusoids? Sinusoids is like they replace capillaries in certain organs like the liver, spleen, bone marrow. and even the suprarenal glands, parathyroid glands, carotid body, etc. Look at these. These are capillaries, continuous fenestrated, that means they have holes, is it? Fenestrations, and this is sinusoid. There are like gaps here. Slightly difficult, I think, to understand, but you should know that there are two types of capillaries. That is the continuous and the fenestrated. Continuous, you can see here, there are no fenestrations. The fenestrated, where will you see? You want some things to come out of it and get filtered, right? This is what you will see in the renal glomeruli or intestinal mucosa. They'll allow passage across their walls for little larger molecules, okay? And when it comes to the sinusoids, their lumen will be larger, okay? And their walls are thinner. They may be incomplete walls, as you can see here. And they may connect the arteriole with a venule. Obviously, that is what is the job of all these capillaries that we are talking about. Guys, at this point, you can understand one topic called as the end arteries, okay? These arteries, actually, they do not anastomose with their neighbors. So, very neighbor unfriendly looks like. These are like the central artery of retina. So, what will happen if this one gets occluded? That's it. The person will become, he can go into blindness. Look at this. This is the optic nerve. In the center of the optic nerve, very nicely, comfortably, an artery is coming through the nerve, within the nerve. Can you imagine? So that is the central artery of retina. It does not anastomose with anybody. It looks like end artery. So it will, if anything happens, then the person can go blind if they do not fix it very soon, right? Similarly, you have the labyrinthine artery, which is an end artery. Then you have the central branches of the cerebral arteries. Then the vasa recta of the mesenteric arteries, spleen, kidney, lungs, metaphysis of long bones. Lot of these have end arteries, okay? So, that's it about end arteries. Now, let's just go back here and say that we have looked at this topic, end arteries. Arteries. Okay. So basically we have looked at all the components of cardiovascular system. Haven't we looked at all the components of cardiovascular system, guys? We have, isn't it? So now let us look at some importance of the system. We told you cardiovascular system. Basically you will talk about the blood pressure. Yes, we'll talk about the heart rate. Yes, heart rate. Then you will talk, that is the pulse. You can say if you feel the heart rate, counter the heart rate at the artery, so that will become pulse. Right, then you will check what else we told you, pallor, anemia, all that you check that, but I think let's not put that here. What else? This is all applied anatomy, guys. Then what else do you talk about? Some important things we told you, varicose veins, right, in security guards who stand a lot, etc. Then you have what else is there? Embolism, thrombus formation. Thrombus formation because of this blood clot, right? There can be that could become a thrombus formation that can become an emboli. Emboli means it will block the path, right? That can become an emboli, which could be dangerous, fatal. It can become. There are some things called as aneurysm. Aneurysm means if this is the blood vessel, it can become a little ballooned up like this here. So this is an aneurysm, okay? And in this, if there is a blood clot, it's a thrombus. If it blocks it, it becomes an emboli. So that's it, guys. Let's take a recap of what we have seen in this topic. We wanted to look at cardiovascular system under general anatomy. Basically, it is transporting things throughout the body via blood, actually. The nutrients are conveyed to places where they are utilized. Metabolites are conveyed to places where they are expelled. Example, kidney. Now, there are two types of circulation, systemic circulation and pulmonary circulation. Systemic circulation means it is from the heart to body to back to heart. This is systemic circulation. Pulmonary circulation is heart to lung to heart. So basically here the whole idea is to oxygenate the blood. Here once it returns to the heart, it will pump the oxygenated blood to the body, and the body will use this oxygenated blood and return the deoxygenated blood to heart. Okay, so let me write this: heart to body, red; lung to heart, red; body to heart, deoxygenated blood; heart to lung, deoxygenated blood. Okay, so there are two types of circulation: pulmonary circulation and systemic circulation. Then we saw the components of cardiovascular system. Heart, mainly a mechanical pump. Arteries, we told you what and all are the features. There are large artery, medium artery, arterioles. Basically arteries are thick walled, lumen is small, and there are no valves. There is something called as end arteries, which do not anastomose with anybody, like central retinal artery. Veins, basically in this you should know that there is a caval system, that is the IVC, inferior vena cava, superior vena cava, etc. And then you have the portal veins. And there can be anastomosis between these two things at the lower end of esophagus, or at the anal canal, or at a bare area of liver, or at the umbilicus. So many places where it can have some portocaval shunts. Then the small ones are called as venules. Arterioles for the arteries and venules for the veins. Between these arterioles and venules, you will find these capillaries, which are actually what did you see about the capillaries? Basically, they can be continuous or fenestrated or sinusoid. Continuous you have seen here. Fenestrated will have some holes like for glomerular filtration, etc. Sinusoids, basically they'll have incomplete wall itself. Basically, you will see this in where? You will see them in the liver, spleen, let's remember spleen, bone marrow, etc. Anyways, then coming to what else did we see, guys? We saw the capillaries. Then we saw that this is the calf muscle. Basically, the soleus is called as the peripheral heart. That's pumping the venous blood back to the heart. Vein, you can see, have valves here. If this fails, then there will be varicose veins. This is the capillary between the arterioles and the venule. Then what else did we see? We saw what end arteries are, example of that. Then we saw applied anatomy, basically blood pressure, heart rate, pulse, varicose veins, thrombus, emboli, aneurysms, etc. Okay, atherosclerosis, so many things are there, vascular diseases. So that's it about the cardiovascular system, general anatomy. Bye bye. Guys, just one basic thing, where does the blood come from? The blood actually comes from your bone marrow, right? The bone marrow makes the blood. Where is it? Let's put it here. So blood is made up of what? Blood has RBCs, there is blood plasma, right? It has WBCs, it has platelets, right? It has glucose, amino acids, it has albumin, that's proteins, right? It has fatty acids. What else? Oxygen it carries. The RBCs carry oxygen, right? Look at the components of blood, right? RBCs, WBCs, platelets, plasma. Some other things you check for, in blood you will check for liver enzymes, liver function test, right? Liver enzymes. You will check for urea. You will check for creatinine, that will indicate renal function test, right? Urea, creatinine. Then there are some, what else that you have to check for? In some pathological things, you can say it will be carrying some parasites. So many things. And what happens to all these RBCs, it is destroyed by this organ called as spleen. So, if you would have heard this word spleen a lot, right? So, spleen is there here, only one side it will be there. It's looking like kidney here the way I have drawn it, but actually spleen, what it will do is it will remove these old RBCs. So, the spleen's job is to remove the old RBCs. Okay. So, spleen is something that only one you have, okay, not on two on both sides like kidney. Spleen is only one and it will remove the old RBCs. So many other things, carbon dioxide also you can see, right, nitrogen. So that's it for now, guys. We'll meet you in the next video. Bye bye.